Question 1. A client in early recovery expresses strong cravings and an intense desire to use substances during a counseling session. The most appropriate initial response by the counselor is to A. Immediately refer the client to an inpatient detoxification facility. B. Explore the triggers and coping mechanisms the client is currently using or lacking. C. Advise the client that cravings are a normal part of recovery and will eventually pass. D. Focus on positive affirmations and remind the client of their progress. Answer B. Explore the triggers and coping mechanisms the client is currently using or lacking. This question addresses a common scenario in early recovery, focusing on the counselor's immediate, most effective intervention for cravings. While cravings are normal and progress should be affirmed, the core concept tested here is active intervention and skill building in the moment. The most appropriate initial response is to actively engage with the client to understand what prompted the cravings and to help them identify or develop strategies to manage them. For example, helping a client recognize that stress from work often leads to cravings allows them to proactively develop stress reduction techniques. A good takeaway is that addressing the how and why of a client's current struggle equips them with practical tools, rather than just offering reassurance or immediate, drastic measures. Question 2. During an initial assessment, a client reports occasional, heavy alcohol use but denies any negative consequences or problems associated with it. However, the client's family has expressed significant concerns. According to the trans-theoretical model, TTM, which stage of change is this client most likely in? A. Action. B. Contemplation. C. Pre-contemplation. D. Preparation. Answer C. Pre-contemplation. This question tests understanding of the trans-theoretical model, TTM, specifically identifying the pre-contemplation stage. The key clues are the client's denial of problems despite family concerns, indicating a lack of awareness or unwillingness to acknowledge the issue. In pre-contemplation, individuals are not considering change and may underestimate the negative impacts of their behavior, often due to denial or lack of information. For instance, someone might say, "I drink a lot, but it's not hurting anyone," even if their family is deeply worried. A good takeaway is that clients in pre-contemplation often need information and empathy, not pressure, to begin moving toward change. Question 3. A client consistently misses scheduled group therapy sessions but attends individual counseling. When confronted, the client expresses discomfort in group settings and prefers one-on-one interaction. How should the counselor best address this situation while upholding ethical principles? A. Discharge the client from the program for non-compliance with treatment expectations. B. Mandate group attendance, explaining it is a program requirement for all clients. C. Explore the client's reasons for discomfort and collaboratively discuss alternative solutions or accommodations. D. Refer the client to a different agency that offers only individual therapy. Answer C. Explore the client's reasons for discomfort and collaboratively discuss alternative solutions or accommodations. This question centers on client-centered care and ethical flexibility within treatment planning. The core concept is adapting treatment to client needs while maintaining therapeutic integrity, rather than rigid adherence to rules or premature discharge. The counselor should first seek to understand the underlying issues causing the client's discomfort in group settings. Collaboratively exploring reasons for discomfort and discussing potential accommodations, such as gradually integrating into a smaller group or finding a different group dynamic, respects client autonomy and maximizes the chance of successful engagement. For example, a client with social anxiety might benefit from a support group with a more structured agenda or fewer participants initially. The key takeaway is that effective counseling often involves adapting the approach to meet the unique needs of the individual while still achieving treatment goals. Question 4. A client in recovery frequently talks about feeling overwhelmed by past mistakes and expresses intense guilt and shame. Which of the following therapeutic approaches would be most effective in helping the client process these emotions and move forward? A. Dialectical behavior therapy, DBT. B. Motivational interviewing, MI. C. Cognitive behavioral therapy, CBT. D. Psychoeducation. Answer, C. Cognitive behavioral therapy, CBT. This question tests the understanding of various therapeutic approaches and their specific applications. The keywords overwhelmed by past mistakes, intense guilt and shame, and process these emotions point directly to the core mechanisms of cognitive behavioral therapy, CBT. CBT helps clients identify, challenge, and change distorted thought patterns and beliefs that contribute to negative emotions like guilt and shame. For example, a client might believe I am a bad person because of my past actions, and CBT would help them reframe this to my past actions were problematic, but I can learn from them and make amends. The takeaway is that CBT is excellent for directly addressing the negative thought patterns that fuel intense emotions such as guilt and shame. Question 5. During a supervision session, a new counselor expresses frustration that a client is resistant to discussing their substance use patterns, despite clear evidence of negative consequences. The supervisor should advise the counselor to primarily focus on A. Confronting the client more directly with the evidence of their substance use problems. B. Exploring the client's ambivalence and building rapport to enhance motivation for change. C. Terminating the client's services due to lack of engagement in the treatment process. D. Providing the client with extensive educational materials on the dangers of substance use. Answer, B. Exploring the client's ambivalence and building rapport to enhance motivation for change. This question highlights a common challenge in addiction counseling and tests the appropriate supervisory guidance, particularly aligning with motivational interviewing, MI, principles. When a client appears resistant, it's often a sign of ambivalence rather than outright defiance. The most effective approach is to explore this ambivalence and strengthen the therapeutic relationship, fostering trust and a non-judgmental environment. For example, instead of pushing, a counselor might ask, "What are some of the good things about using, and what are some of the not-so-good things?" This allows the client to voice both sides without feeling judged. A crucial takeaway is that building rapport and exploring ambivalence are fundamental to helping clients recognize their own reasons for change. Question 6. A counselor receives a subpoena for a client's records. The client has not provided a release of information. According to ethical guidelines and legal requirements, the counselor's most appropriate immediate action is to A. Immediately release the requested records to the court as mandated by the subpoena. B. Contact the client to inform them of the subpoena and discuss options, including seeking legal counsel. C. Refuse to release any information, citing client confidentiality, and await further legal action. D. Consult with a colleague for advice on how to proceed without informing the client. Answer, B. Contact the client to inform them of the subpoena and discuss options, including seeking legal counsel. This question addresses a critical ethical and legal dilemma concerning client confidentiality and subpoenas. The concept being tested is the counselor's responsibility to protect client rights while also adhering to legal processes. A subpoena does not automatically override confidentiality. Counselors must first notify the client to allow them the opportunity to consult legal counsel and potentially quash the subpoena. For example, a counselor might tell a client, "I've received a subpoena for your records," and we need to discuss your options regarding how to respond. The crucial takeaway is that client notification and collaboration are paramount before any confidential information is released, even when a subpoena is received. Question 7. Which of the following best describes the primary purpose of a warm handoff in addiction treatment? A. To refer a client to a higher level of care after a relapse. B. To transfer a client's care to another professional in a supportive and seamless manner. C. To introduce a client to a peer support group facilitator. D. To discharge a client from treatment with appropriate aftercare recommendations. Answer: B. To transfer a client's care to another professional in a supportive and seamless manner. This question tests a key concept in integrated and collaborative care within addiction treatment. A warm handoff describes the process of directly connecting a client with a new provider or service, ideally through a face-to-face introduction or direct phone call. This method aims to reduce client anxiety and increase the likelihood of follow-through by fostering trust and continuity of care. For instance, a counselor might personally walk a client to a new therapist's office and introduce them, rather than simply giving them a referral slip. The takeaway is that a warm handoff is about creating a smooth, personal transition that maximizes the client's engagement in ongoing support. Question 8. A counselor is working with a client who has a co-occurring mental health disorder and a substance use disorder. The most effective approach to treatment for this client is typically A. Sequential treatment, addressing the substance use disorder first, then the mental health disorder. B. Parallel treatment, addressing both disorders separately with different providers at the same time. C. Integrated treatment, addressing both disorders concurrently within the same treatment plan and team. D. Prioritizing the more severe disorder and only addressing the other if the first improves. Answer: C. Integrated treatment, addressing both disorders concurrently within the same treatment plan and team. This question focuses on best practices for treating co-occurring disorders, often referred to as dual diagnoses. The concept being tested is the superiority of integrated treatment. This approach acknowledges the interconnectedness of mental health and substance use disorders, treating them simultaneously and holistically within a single, coordinated framework. For example, a client experiencing both depression and alcohol dependence would receive therapy that addresses how their depressive symptoms might trigger drinking, and how alcohol use exacerbates their depression, all from the same treatment team. The key takeaway is that integrated treatment views co-occurring disorders not as two separate problems, but as aspects of one complex condition that needs a unified approach. Question 9. In the context of the IC&RC examination, which of the following is considered a primary ethical responsibility of an addiction counselor regarding client welfare? A. Advocating for stricter legal penalties for substance use offenses. B. Maximizing the counselor's personal income through client fees. C. Practicing within the boundaries of their competence and scope of practice. D. Encouraging clients to convert to the counselor's personal belief system. Answer: C. Practicing within the boundaries of their competence and scope of practice. This question directly assesses a fundamental ethical principle in addiction counseling: competence and scope of practice. The core concept is that counselors have a duty to only provide services for which they are qualified through education, training, and supervised experience. This ensures client safety and effective treatment outcomes, preventing harm from unqualified interventions. For example, an addiction counselor would not provide psychiatric medication management, as that falls outside their scope of practice. The crucial takeaway is that upholding client welfare means knowing your professional limits and referring clients to specialists when their needs exceed your expertise. Question 10. A client reports intense anxiety and restlessness, difficulty sleeping, and an elevated heart rate after abruptly stopping a substance. These symptoms are characteristic of A. Post-acute withdrawal syndrome, pause. B. Acute withdrawal syndrome. C. Substance-induced psychosis. D. Tolerance. Answer B. Acute withdrawal syndrome. This question tests the understanding of immediate physiological reactions to substance cessation. The keywords abruptly stopping a substance, intense anxiety and restlessness, difficulty sleeping, and elevated heart rate are classic indicators of acute withdrawal syndrome. This occurs shortly after discontinuing a substance to which the body has become dependent, representing the body's attempt to re-establish homeostasis without the substance. For example, someone who stops heavy alcohol use might experience tremors, sweating, and confusion in the acute withdrawal phase. The takeaway is to recognize these immediate, often severe, physiological symptoms as distinct from longer-term issues like pause, and indicative of a need for medical management. Question 11. What is the primary purpose of conducting a thorough biopsychosocial assessment at the beginning of treatment? A. To determine the client's eligibility for specific insurance benefits. B. To gather comprehensive information to develop an individualized treatment plan. C. To diagnose all potential co-occurring mental health disorders immediately. D. To identify any criminal history that might impact the client's legal status. Answer B. To gather comprehensive information to develop an individualized treatment plan. This question focuses on the foundational step of client engagement, the biopsychosocial assessment. The core concept is that this assessment serves as the cornerstone for all subsequent treatment decisions, providing a holistic view of the client's life. By collecting information on biological, health, substance use history, psychological, mental health, coping skills, and social, family, work, culture, environment factors, counselors can create a truly individualized and effective treatment plan. For example, understanding a client's living situation or family support allows the counselor to incorporate these factors into their recovery strategy. A vital takeaway is that a thorough assessment ensures treatment is tailored precisely to the client's unique needs and circumstances. Question 12. A counselor is facilitating a psychoeducational group on relapse prevention. A client repeatedly dominates the discussion, frequently interrupting others and diverting the topic. The most appropriate action for the counselor is to A. Allow the client to continue, as it shows engagement in the group process. B. Politely interrupt the client and redirect the discussion back to the group's agenda, inviting others to share. C. Ask the client to leave the group for being disruptive. D. Address the client's behavior in an individual session after the group. Answer B. Politely interrupt the client and redirect the discussion back to the group's agenda, inviting others to share. This question addresses a common group facilitation challenge and tests the counselor's ability to manage group dynamics effectively and ethically. While client engagement is positive, one individual dominating prevents others from participating and detracts from the group's purpose. The most appropriate action is to maintain boundaries and ensure equitable participation by politely intervening and redirecting the conversation to the group's goals. For example, a counselor might say, "Thank you for sharing, John. Let's hear from others now on this topic." The key takeaway is that effective group facilitation balances individual expression with the collective needs and goals of the entire group. Question 13. Which of the following best exemplifies unconditional positive regard in a counseling relationship? A. Agreeing with all of the client's decisions and choices. B. Expressing warmth and acceptance toward the client regardless of their actions or choices. C. Offering constant praise and compliments to boost the client's self-esteem. D. Setting no boundaries or expectations for the client's behavior in therapy. Answer B. Expressing warmth and acceptance toward the client regardless of their actions or choices. This question tests understanding of Carl Rogers' core therapeutic concept of unconditional positive regard. It is about valuing the client as a human being worthy of respect, even if the counselor disagrees with or disapproves of their specific behaviors. This creates a safe, non-judgmental environment essential for honest self-exploration and change. For example, a counselor might say, "I hear how much you're struggling, and I'm here to support you, even if I don't agree with the choices you've made." The vital takeaway is that unconditional positive regard means separating the person from their problems, offering consistent acceptance that fosters trust and open communication. Question 14. A client, 3 months into recovery, suddenly expresses a strong desire to reconnect with old friends who are still actively using substances. Which of the following is the most significant risk factor associated with this decision? A. Increased financial strain. B. Social isolation. C. Relapse. D. Development of new mental health issues. Answer C. Relapse. This question directly addresses a critical aspect of relapse prevention. The concept being tested is the understanding of high-risk situations and triggers in early recovery. Reconnecting with active users often exposes the client to familiar environments, cues, and social pressure that directly increase the likelihood of returning to substance use. For example, if a client returns to their old using group, they are immediately placed in an environment where substance use is normalized and readily available. The significant takeaway is that social environments play a powerful role in recovery, and exposure to active using peers is a major predictor of relapse. Question 15. The purpose of a contingency management intervention in substance abuse treatment is primarily to A. Help clients identify and challenge distorted thought patterns. B. Provide incentives for desired behaviors and reduce negative behaviors. C. Explore past traumas that contribute to substance use. D. Teach clients new coping skills for managing stress. Answer B. Provide incentives for desired behaviors and reduce negative behaviors. This question defines a specific behavioral therapy approach, contingency management. The core concept is using principles of operant conditioning to modify behavior by systematically reinforcing positive actions and discouraging negative ones. This often involves providing tangible rewards or privileges for abstinence or participation in treatment. For example, a client might earn vouchers for negative drug tests, which they can then exchange for goods or services. The key takeaway is that contingency management is a structured system of rewards and consequences designed to motivate clients toward recovery-oriented behaviors. Question 16. A client expresses frustration during a session, stating, "My family doesn't understand anything I'm going through." The counselor should primarily respond by A. Advising the client to distance themselves from their unsupportive family. B. Validating the client's feelings and exploring their perceptions of their family's lack of understanding. C. Immediately shifting the focus to how the client can educate their family about addiction. D. Suggesting that the client's family might have their own unresolved issues. Answer B. Validating the client's feelings and exploring their perceptions of their family's lack of understanding. This question emphasizes a fundamental counseling skill, empathy and active listening. The core concept is to first validate the client's expressed emotions and then explore the underlying meaning of their statement. This shows respect, builds rapport, and provides deeper insight into the client's experience before jumping to solutions or interpretations. For example, a counselor might say, "It sounds like you feel very alone and misunderstood by your family. Can you tell me more about what makes you feel that way?" The takeaway is that validating feelings and seeking clarification builds trust and opens the door for meaningful therapeutic work. Question 17. Which of the following best describes the principle of harm reduction in addiction treatment? A. Requiring complete abstinence from all substances as the only acceptable goal. B. Reducing the negative consequences associated with substance use without necessarily requiring abstinence. C. Focusing exclusively on legal consequences of substance use. D. Advocating for increased punishment for individuals who use illicit drugs. Answer: B. Reducing the negative consequences associated with substance use without necessarily requiring abstinence. This question directly tests the understanding of harm reduction, a significant approach in addiction services. The core concept of harm reduction is to minimize the adverse health, social, and economic consequences of substance use, even if the individual is not yet ready or able to achieve abstinence. For example, providing clean needles to intravenous drug users prevents the spread of diseases like HIV and hepatitis, even if the person continues to use drugs. The vital takeaway is that harm reduction prioritizes saving lives and improving well-being by meeting clients where they are, rather than demanding immediate, perfect behavioral change. Question 18. A client requests that their counselor attend a family court hearing to provide testimony regarding their progress in treatment. The counselor should: A. Decline the request, as counselor attendance in court is always unethical. B. Agree to attend and provide testimony, without needing a client release of information. C. Discuss the request with the client, explain the implications of testifying, and obtain a valid written release of information if proceeding. D. Send a written report to the court instead of appearing in person, to maintain confidentiality. Answer: C. Discuss the request with the client, explain the implications of testifying, and obtain a valid written release of information if proceeding. This question addresses the complex ethical and legal considerations when a client requests a counselor's involvement in legal proceedings. The core concept is upholding confidentiality and client autonomy while navigating external demands. Before any disclosure, a counselor must discuss the potential impacts, both positive and negative, with the client and obtain a specific, informed, and written release of information. For example, testifying could mean sensitive information becoming public record, which the client needs to understand fully. The crucial takeaway is that client consent and full disclosure of potential consequences are paramount before a counselor participates in legal proceedings. Question 19. A key component of trauma-informed care in addiction treatment is: A. Focusing primarily on the client's substance use behaviors, ignoring past experiences. B. Understanding and responding to the impact of trauma on an individual's life and behavior. C. Requiring clients to disclose all traumatic experiences in detail during initial assessment. D. Providing only medication-assisted treatment, MAT, for all clients with a history of trauma. Answer: B. Understanding and responding to the impact of trauma on an individual's life and behavior. This question defines a foundational aspect of modern addiction counseling, trauma-informed care. The concept being tested is the recognition that trauma is highly prevalent among individuals with substance use disorders and significantly impacts their coping mechanisms, trust, and engagement in treatment. Trauma-informed care involves creating a safe environment and integrating an understanding of trauma's effects into all aspects of service delivery, avoiding re-traumatization. For example, a trauma-informed counselor avoids power struggles and offers choices, understanding that control was often stripped from trauma survivors. The vital takeaway is that recognizing and addressing trauma's role is crucial for effective and ethical addiction treatment. Question 20. When developing a treatment plan for a client, the most effective goals are typically A. Broad and aspirational, such as achieve happiness. B. Counselor-driven and easily measurable by the counselor. C. Specific, measurable, achievable, relevant, and time-bound, SMART. D. Focus solely on eliminating substance use, regardless of other life areas. Answer, C. Specific, measurable, achievable, relevant, and time-bound, SMART. This question tests the understanding of effective goal setting in treatment planning. The core concept is using the SMART criteria to create concrete and actionable goals that genuinely guide the client's progress. Goals that are specific, measurable, achievable, relevant, and time-bound provide clarity and a framework for both the client and counselor to track progress effectively. For example, instead of reduce drug use, a SMART goal would be attend 3 NA meetings per week for the next month. The key takeaway is that SMART goals transform vague intentions into clear steps, making treatment more focused and outcomes more attainable. Question 21. A client who has been stable in recovery for several years suddenly reports feeling restless, irritable, and discontent and finds themselves thinking about old using behaviors. This description is most indicative of A. A full-blown relapse episode. B. Acute withdrawal syndrome. C. Relapse warning signs or halt cues. D. Post-acute withdrawal syndrome, pause. Answer, C. Relapse warning signs or halt cues. This question focuses on recognizing early indicators of potential relapse. The keywords restless, irritable, and discontent are classic descriptions of internal emotional states often associated with early relapse warning signs, frequently referred to by the acronym HALT: hungry, angry, lonely, tired. These are not acute physical withdrawal symptoms, nor are they a full relapse, but rather internal cues that signal a need for increased vigilance and coping strategies. For example, a client experiencing these feelings might be heading towards dry drunk syndrome or a period of intense cravings, indicating a need for intervention. The takeaway is that recognizing these subtle emotional shifts early is crucial for preventing a full relapse. Question 22. A counselor observes a colleague consistently coming to work late, appearing disheveled, and exhibiting mood swings. The colleague also avoids supervision and has missed client appointments. The most appropriate initial action for the observing counselor is to A. Immediately report the colleague to the state licensing board. B. Confront the colleague directly during a client session about their behavior. C. Document observations and consult with a supervisor or the agency's ethical committee. D. Assume the colleague is going through a personal crisis and offer informal support. Answer, C. Document observations and consult with a supervisor or the agency's ethical committee. This question addresses a significant ethical dilemma involving impaired colleagues. The concept being tested is the ethical responsibility to address potential impairment in a professional, systematic, and confidential manner. While concern for the colleague is valid, the primary duty is to protect client welfare and maintain professional standards. The most appropriate initial step is to document observations and report concerns to a designated supervisor or ethical committee, who can then intervene appropriately and discreetly. For example, a counselor might tell their supervisor, "I've noticed John has been late frequently and seems distressed. I'm concerned about his well-being and its potential impact on clients." The key takeaway is that professional concerns about a colleague's impairment should always be addressed through proper channels within the organizational structure to ensure client safety. Question 23. A core principle of client-centered therapy in addiction counseling is: A. The counselor provides expert advice and dictates the treatment path. B. The client is viewed as the expert on their own experiences and has inherent potential for growth. C. The therapy focuses primarily on uncovering unconscious conflicts from childhood. D. The therapeutic process is primarily driven by behavioral conditioning and rewards. Answer: B. The client is viewed as the expert on their own experiences and has inherent potential for growth. This question delves into a fundamental philosophy of counseling, client-centered therapy, developed by Carl Rogers. The core concept is that the client possesses internal resources for growth and change, and the counselor's role is to facilitate this self-discovery through empathy, unconditional positive regard, and congruence. This approach empowers clients by respecting their autonomy and inherent wisdom about their own lives and recovery journey. For example, instead of telling a client what to do, a client-centered counselor might ask, "What do you think would be the most helpful next step for you?" The key takeaway is that client-centered therapy positions the client as the primary agent of change in their own recovery. Question 24. Which of the following best defines the term polysubstance use? A. The use of a single, highly addictive substance. B. The use of prescription medications only. C. The use of 3 or more different substances in the same week. D. The concurrent or sequential use of 2 or more psychoactive substances. Answer: D. The concurrent or sequential use of 2 or more psychoactive substances. This question tests a common term in addiction diagnosis and treatment. The concept of polysubstance use refers to the pattern of using multiple psychoactive substances, either at the same time, concurrently, or one after another, sequentially. This often leads to more complex clinical presentations, increased health risks, and greater challenges in treatment. For example, an individual who regularly uses both alcohol and cannabis, or combines opioids with benzodiazepines, would be considered a polysubstance user. The crucial takeaway is that polysubstance use complicates assessment and treatment, requiring a broader understanding of drug interactions and withdrawal symptoms. Question 25. A client expresses strong resistance to attending Alcoholics Anonymous (AA) meetings, stating they prefer a secular approach to recovery. The counselor should: A. Insist the client attend AA, emphasizing its proven effectiveness for many. B. Explore the client's reasons for resistance and offer alternative secular support groups or therapeutic approaches. C. Advise the client that all effective recovery programs have a spiritual component. D. Terminate treatment, as the client is not committed to a well-established recovery pathway. Answer: B. Explore the client's reasons for resistance and offer alternative secular support groups or therapeutic approaches. This question addresses client resistance and the importance of tailoring treatment to individual beliefs and preferences, especially regarding recovery pathways. The core concept is meeting the client where they are and respecting their autonomy while still promoting engagement in supportive recovery activities. Instead of forcing a specific model, an effective counselor explores the client's concerns and offers alternatives that align with their values, such as smart recovery, women for sobriety, or individual therapy focusing on secular coping skills. For example, if a client finds the spiritual language of AA off-putting, a counselor could introduce them to a non-12-step mutual aid group. The vital takeaway is that flexibility and client-centeredness in recovery planning are crucial for sustained engagement and successful outcomes.